الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Decompression Sickness Clinic, or the clinic for prevention and management of decompression sickness among workers, by Professor Mahmoud Hani Sulaiman. This is a list of the physical hazards we are discussing in this section of occupational health. Decompression sickness definition: manifestation due to abrupt reducing of ambient pressure, which will lead to liberation of dissolved gases into the blood to be in form of gas bubbles. Occupational exposures: divers, K-zone workers during building of bridges or underwater tunnels, construction of underwater cables or tubes, military aviators. This is picture for divers. This is a simple diagram of K-zone. Water is got out through here, air in through here, and by this simple method, what the worker is doing is they move dust, move rocks from here. They are digging and put it out. This is real K-zone from above. It is large. Workers go inside it. It is large. This is a nice photo for real K-zone, and here is the boat to show you the volume of this K-zone. It is large. Pathology of decompression sickness: under 1 atmospheric pressure, air pressure of 1 liter of nitrogen dissolved in blood and tissue, especially fatty tissue. With each increase of pressure, there is parallel increase of dissolved nitrogen. Working in some occupations necessitate exposure to increased air pressure. So increase amount of this, like working in K-zone. So increase amount of dissolved nitrogen in blood. Gradual decompression will give chance for dissolved gas to be liberated and exhaled by the lungs. But unfortunately, this is not the case at each time. If the worker ascend not gradually, acute effects will be sudden ascent of divers or sudden decompression of K-zones. Manifestation depend on body site where air bubbles accumulate. Cardiorespiratory manifestations: pulmonary air embolism, which will lead to severe difficulty in breathing and sense of shocking, may lead to asphyxia. Joints: accumulation of air in joints will lead to severe pain and joint flexion, which equal bends. This is a rest sign. Continued health effects: GIT, accumulation of air in bowels, will lead to intense abdominal colic. CNS manifestation depend on site of lesion, either paralysis, vertigo, cranial pulse. Usually, case recovers, but permanent lesions may remain. Skin: accumulation of air in subcutaneous tissue. Chronic delayed effect for decompression sickness. CNS manifestation: different type of paralysis or cranial palsy. This occurs if rapid treatment of acute condition is delayed. Bone: aseptic bone necrosis. Common sites are ends of humerus, femur, or tibia. This is a summary of assessment of a patient with decompression illness. Evolution: is it progressive, static, relapsing, or spontaneous, improving? Manifestations: pain, often large joints, e.g. shoulder, the bends. Neurological: any deficit is possible. Audiovestibular: vertigo, tinnitus, nystagmus may mimic inner ear barotrauma. Pulmonary: chest pain, cough, hemoptysis, dyspnea may be due to arterial gas embolism. Cutaneous: itching, erythematous rash. Lymphatic: tender lymph nodes and edema. Constitutional: headache, fatigue, and general Malaise. Dive profile. What is the depth of the diving? Type of gas used, duration of dive. The manifestation, either pain, neurological, audiovestibular, pulmonary manifestations, cutaneous manifestation, lymphatic manifestation, and constitutional manifestation. Treatment is rapid compression in decompression chamber, then gradual decompression. This is the decompression room, and these are the valves which control the room. Here is two patients with decompression sickness and breathing oxygen inside the room. Prevention of decompression sickness, it is to follow rules, and tables of compression and decompression which indicate duration of exposure to pressure and the grades of decompression. Decompression chamber should be provided where there is exposure to work under increased atmospheric pressure. Osteonecrosis, a serious complication of hyperbaric work due to decreased blood flow within bone structures, which will lead to section of normal bone dies and replaced by softer material. If it occurs below surface of a joint, such as hip, there is a real risk of joint surface collapsing, which will lead to permanent disability. Barotrauma equal damage to an air-containing organ by pressure exerted across a structure, typically in ear or respiratory tract. Individuals exposed to pressure, to increased pressure, must be able to equalize such pressure, e.g. by steady exhalation during ascent from diving. Risk of barotrauma is decreased by excluding workers with upper respiratory tract infection and by control of rate of change of pressure at compression and decompression. Living and working at high altitude. Living and working at high altitude carries different risks: acute mountain sickness, high altitude pulmonary edema, high altitude cerebral edema. Symptoms of acute mountain sickness occur at 2,500 meters, reaching 40% at more than 4,000 meters. These are headache, nausea, and vomiting, sleep disturbance, muscle weakness, all due to mild lung edema, splanching circulation, and brain. Treatment by descent to a lower altitude, breathing oxygen, acetazolamide, and dexamethasone. Prevention, limit rate of ascent to altitude. Unlike acute mountain sickness, both high-altitude pulmonary edema and high-altitude cerebral edema are life-threatening. The former is treated by descent and use of oxygen. People who live at high altitude show physiological adaptation to their environment, although this may fail with time. Chronic mountain sickness is a loss of tolerance to hypoxia, which occurs particularly in middle-aged men. It results in an erythropoiesis with hematocrit rising as high as 80%. Clinical effects include cyanosis, dyspnea, cough palpitations, and headache. The condition can only be alleviated by moving to a lower altitude. Acceleration. Exposure to sustained accelerations occurs on fair ground rides, 2 to 3 gravity, or in flight and in aerobic or military flying. Radial acceleration occurs during banked turns. When head is to inside of turn, acceleration is positive in z-axis. When head on outside of turn, acceleration is negative in the same axis, that is to say z-axis. Positive gravity increase hydrostatic weight of blood column above heart, decrease arterial pressure and perfusion of retina and brain, while negative gravitation has opposite effect with increased arterial pressure, engorgement of head and neck. Protection from positive G is by keeping body nearer to horizontal plane than vertical, lifting legs up and lowering the backrest. Valsalva maneuver used in anticipation of acceleration to increase pressure in arterial system. Protective anti-G suits routinely worn by military pilots. These prevent pooling of blood in peripheries and limit the descent of heart and diaphragm under acceleration. وفي النهاية أقول الحمد لله و thank you for your good listening.